Okay, تسجيل بدأ. Good morning all. Thank you for attendance to this lecture, which is going to be continued to the first lecture that we have mentioned before. So at the beginning, I'm going to have a review about the previous lecture that I have mentioned before. الآن راح نبدأ بمراجعة بسيطة إلى المحاضرة السابقة اللي ما صار عنده مجال إنه يدخل بيها. راح نراجع بصورة سريعة المحاضرة السابقة and what we have been emphasized on. In the previous lecture, we concentrate or we emphasize on the following. تكلمنا exactly what we mean by the oral medicine, and do we have to attend the lectures to the oral medicine, and we concentrating on the aspect of the oral medicine. What is the oral medicine is deal, and we say that the oral medicine is considered to be as a branch of dentistry which is going to deal with the art of the diagnosis of the following. We concentrating on the oral mucosal lesion, whatever it was, a white and red. We concentrating on the temporomandible joint, and also on the medication, on the medically management or of the immunocompromised patient, and also we concentrate which type of patient we need to have more investigation and how we are going to manage those types of patients. وقلنا بصورة عامة the oral medicine specialist, he will be responsible to say that this types of lesion is considered to be as a normal or benign types of lesion, or this type of lesion may associated with serious condition, and this type is need further investigation. مثل ما تكلمنا هنا مثلا this whitish area which is going to be representing on the lateral surface of the tongue, or this is aphthous area, or this is a major ulcerative area which is going to be representing of oral cavity. هنا يتخذ طبيب الأسنان المختص في هذا المجال in the oral medicine department the full responsibility to say that it is considered to be as a benign, or ممكن يقول it is considered to be as a serious condition and further investigation is required for this patient. Then عرفنا what we mean by the oral medicine, عرفنا aspect of the oral medicine, عرفنا field that we are concerning about. وتكلمنا أيضا in order to make an accurate diagnosis to the patient, we are going to depend on two most important things. We depend on the history from the patient, and we depend on the clinical examination, whether it was extra oral examination or whether it was intra-oral examination. وقلنا in order to make an accurate diagnosis to the patient, we have to take the following information regarding the age, the sex, the present illness, and the family history. هذا هو مقدمة regarding the oral medicine. وتكلمنا على types of the personality that the dentist is going to deal with, and we emphasize on this type of personality, whether it was obsessive, whether it was schizoid, hysterical, paranoid, and so on. And also we emphasize that this or the type of the personality of the patient may add in the diagnosis of the patient and specify in the patient who have a facial pain or have a TMJ disorder. وتكلمنا أيضا المحاضرة السابقة about the type of the question that the dentist is going to be applied during taking history from the patient. And we say that the different modalities of a question is going to be required during taking history from the patient. قسمناها إلى open question or the gold standard, and here we are going to let the patient express about himself, express about the feeling, and to let the patient talk. And another type of question that we are going to be applied during taking history from the patient is question with option. Here the dentist is going to be given a different type of answering, and the patient is going to be choose, and also the leading type of a question. Try always to be avoid as much as possible. Also, we concentrating during taking a history from the patient that the age is very important. وقلنا أهم مشكلة بالage during prescribing the medication مثل ما راح نشوف بمحاضرات الميديكيشن اللي راح نتطرق لها انه كل الفارماكاينيتيك كل الفارمادايناميك all the metabolism of the medication is going to be affected through metabolism and through exertion. يعني بصورة عامة يفيدنا الage نحن هنا لن نصف the same type of medication when we are going to deal with a geriatric patient or 65 or 70 years old. It wasn't be the same dose when we are going to deal with the young patient. Even we have an idea about the different degenerative changes which is occur in the bone and in the joint disease that is going to be affected temporomandible joint or other joint of the body. تكلمنا عن انه with an increasing age there will be change in the joints, and this, as we see, the cartilage erosion and the calcium deposit and the water in the cartilage and the level of the osteoarthritis and so on. All of these is going to be changed with an increasing age. If we want to transfer this into practical points of view, نحاول نربط هذا ويا المعلومات أو ويا the practical points. يعني as a general talking, when I'm going to deal with a patient which is complaining, for example, with the temporomandible joint, and she was a young female, for example, I wouldn't expect the same causes when I'm going to deal with a geriatric patient or with an old patient. I wouldn't suspect to have osteoarthritis, for example, within a young patient. I suspect that the myofascial type of pain and the muscle types of pain, as a general talking, is the main cause when I'm going to deal with a young patient. إذن الآن نحن نتكلم لماذا نحن نركز, why we emphasize on the age of the patient when we are going to take a history, وألخصها مرة أخرى أنه هذا سوف يتأثر ب type of medication that I'm going to be applied and the clinical symptoms of the patient and the different change which is going to be occur in the joint and other area of the body. The نشوف الدنتين, gingival retraction, and so on. Even there are different changes which is occur within age. Undoubtedly, the salivary secretion is going to be decreased, even though the malignancy and the autoimmune disease is going to be affected. In addition, that the secretory immunoglobulin IgA is going to be decreased with an increasing age. إذن هناك الكثير من التغيرات التي تحدث بزيادة العمر بالنسبة للمريض. القسم الكبير, most of these changes may occur in the oral cavity, and we have to take this into consideration. إذن تكلمنا the second part of taking history from the patient, we are going to emphasize on the sex changes. And we saw that there will be sometimes more types of lesion may occur in the females more than in female. Like for example, الميوكوسيل اللي أهم شيء اللي تتكون بالlower lip, ومثل ما راح نشوفها هي extravasating of the small extravasating of the content of the blood vessels of the lower lip. It is mostly occur in the female, in addition to the epulis, which is occur in a pregnancy, and different types of lesion like the mucous membrane pemphigoid and other types of pemphigoid. Another changes which is going to be occur, including the immunological status اللي هي مثل ما تكلمنا ال IgA, الثايموس, الثايموبروتين, lymph node tissue, والانتي body production, in addition to the T lymphocytes and the autoantibody in the is going to be increased also. Even after taking or emphasize on the age and the sex of the patient, we are going to have some idea about the history of the present complaint. مثل ما نعرف الonset, the character, which the area pain is going to be radiating, and if there is any associating factors with these types of pain, and if there is any exacerbating factors like, for example, the heat or cold or talking, it is the factors which is going to be initiating and precipitating the types of pain. And another field that we are going to concentrate when we are going to take a history from the patient is the family history. And we say that two most important factors which is going to be affected the family history مثل ما قلنا autosomal recessive and the autosomal dominant. وأعطينا أمثلة للautosomal recessive like for example the sickle cell anemia and the alpha thalassemia, and also the autosomal dominant like for example the neurofibroma and the myotonic dystrophy and other diseases. أيضا من الأمور اللي شرحناها بالمحاضرة السابقة تكلمنا عن السوشيال هيستوري وتكلمنا عن smoking وقلنا there are different types of lesion which may associate it with the smoking, like for example the leukoplakia or sometimes the nicotinic stomatitis, which is mostly representing on the palate and mostly associated with the smoking. And we take it into consideration that alcoholism patient, and we could know that there will be evaluating in the level of the mean corpuscular volume, and most of them they are complaining from vitamin B12 or folate deficiency. And even though they are complaining from abnormal liver function test, then those types of patients may have a defect in a PT, prothrombin time, activated partial thromboplastin time, and the bleeding time because they are complaining from impaired in the liver function test. وبصورة عامة there are main systems which should be made during any examination of the patient. This is the most type of system which is going to be reflect its effect on the oral cavity, whether direct or whether indirect through the types of treatment which is going to be applied. For example, the cardiovascular system, respiratory system, the GIT, neurology, and so on. All of these systems is going to be reflect its effect on the oral mucosal area through direct or indirect. إذا هذا هو الغرض الرئيسي. أعيد بصورة مختصرة من أخذنا إلى الهيستوري of the patient. إنه first of all we are going to emphasize on the confidential relationship between you and between the dentist, and also you are going to discover some of the systemic disease which is directly affect the oral mucosa, or you are going to explore the types of medication مثل ما راح نشوف بالمحاضرات القادمة الأدوية اللي ممكن أنه تؤثر على الأورال mucosal area, and sometimes it may associate it with a petechia or ecchymosis or pigmented area on the oral cavity. إذن هذا هو الغرض الرئيسي من taking the history from the patient. لهنا كانت مراجعة إلى المحاضرة الأولى اللي أخذناها. الآن راح نبدي بمحاضرة هذا اليوم. أنا كتبت لكم أيضا إذا أي أحد عنده سؤال أو أي أحد عنده استفسار أثناء إلقاء المحاضرة ممكن يسجله يما بورقة وقلم وتتصلون بممثل المرحلة يرتب لي وقت معين بحيث يناسب الجميع. I will be ready to answer any question that's relevant to my subject. الطالب اللي عنده أي سؤال، الطالب اللي عنده أي استفسار فيما يخص الموضوع أو في الأورال ميديسين يسجله يما بورقة، يتصل بممثل الشعبة مالتكم يرتب لنا موعد يناسب الجميع انه ممكن نجاوبكم على هاي الاسئله. Please do not hesitate to ask any question regarding our subject. لا تتردد بسؤال شيء. اذا بعد ان خلصنا الهيستوري اوف ذا بيشنت وراجعنا المحاضره الاولى، الان نبدا بالمحاضره الثانيه او هو تكمله للمحاضره الاولى. هذه المحاضرة تتكلم how we are going to make an accurate diagnosis to the patient. نمود نسوي examination of the patient ينقسم إلى نقطتين رئيسية اللي هي extra oral examination and the intra-oral examination. راح نركز في هذه المحاضرة على extra oral examination. أنا ما أقول لك أنت راح تتحول إلى physician ولا أقول لك أنت راح تصير general medicine، لكن أنت كطبيب أسنان متخرج جديد يجب أن يكون لديك بعض المعلومات in order to clarify whether this patient is complaining from a serious systemic diseases which is going to be influence the type of treatment which is going to be applied to the patient. أنا ما أقول لك أنت راح تتحول إلى طبيب، لكن يجب عليك انه تعرف او emphasize او تركز على general examination or general examination قبل ان تدخل الى الانترا oral examination. في هذه المحاضرة وبالمحاضرات السابقة راح اعلمك شغلات بسيطة كلش، اخليك تستفاد من الاكسترا oral examination انه you are going to make your decision that this patient is considered to be normal and you could apply further types of treatment to him. انت ممكن ان تعطيه العلاج وفي نفس الوقت اخليك تتعلم اذا ركزت وياي يا ابني الى شغلات ممكن انه وراها يبين انه هذا المريض هو it is not considered a well يعني a well healthy patient and you need a further investigation for him. هذه الامور اللي هي الاكسترا اورال اكزامينيشن تمنعك انه تقع بالكثير من الاخطاء اثناء تعاملك ويا المريض. تخليك تعرف whether this patient is considered to be normal and you could carry on your dental treatment, or this patient is not considered normal. The further investigation and you have to refer this patient for physician. مثل ما نعرف مثل بسيط عندنا بالاورال ميديسن انه انتبه عليه وتخليه في حياتك العمليه ابني. You have to be alert and caution rather than be impressed and sorry. يجب ان تكون حذر واليرت احسن من بعدين تقول سوري. كيف تكون حذر واليرت؟ تكون حذر وتكون alert من خلال البيسك نولج اوف انفورميشن، من خلال المعلومات اللي تكون موجوده عندك، وبالتالي اذا لم تمتلك المعلومات سوف تصبح مجرد technical word وسوف لن تستحق لقب طبيب بجدارة. Anyhow, if you want to make an extra oral examination, you have to notice the following: the abnormal movements. ماذا نعني بالabnormal movement? Even though before the patient is going to be sitting on the dental chair, قبل ما المريض يقعد على dental chair, you could notice how the patient is going to be walking, because there are many neurological types of disease which is going to be affected the type of walk of the patient. Like for example, patient with a multiple sclerosis or patient with تصلب نسميه بالعامية تصلب الأعصاب المنتشر. Those types of patient may have a loss of their sensation in the lower extremities. يعني يفقد حاسية حتى بالأطراف السفلى له، فالمشي مالته يكون عن طريق الشفل types of movement. If you misdiagnose this patient, you have to know that these types of patient under a heavy dose of immunosuppressive types of medication. إذا لم تستطيع تشخيص هذا المريض قبل أن يقعد عندك على الdental chair and you are carrying on your dental treatment and this patient هذا المريض يأخذ دوز عالي من الكورتيكوستيرويد وغيرها you may face a crisis مثل ما راح نشوف بالمحاضرات السابقة. Even though if patient attending you with a wheelchair and you do not know exactly why this patient is on the dental chair or on the wheelchair, this patient, for example, may have a previously CVA. Those types of patients, actually, they are taking anticoagulant types of medication, like, for example, the heparin and warfarin and the Plavix. If you do not notice them well, you may face a crisis during dealing with them. Again, patient with rheumatoid arthritis, they are taking immunosuppressive type of medication, like, for example, methotrexate وغيرها. Even this may influence the type of a treatment. ما أريد أوصل لك إياه إنه before انتبه عليه قبل أن المريض يقعد على الدنتال chair you have to notice يجب أن تلاحظ the way of the walking of the patient because sometimes it may associate it with the systemic diseases which is going to be influence the oral health structures directly or indirectly. Even we have to notice if the patient is complaining from abnormal movement. وهنا sometimes there will be involuntary movement and this may occur due to the organic disease of the central nerve system, particularly when the extrapyramidal system is going to be involved. Or may be result from primary disease. يعني ممكن المشكلة الابnormal types of movement ممكن أن تكون بالcentral nerve system وممكن أنه تكون بالحالات التالية اللي راح نتكلم عليها. Sometimes the patient may complain from the thyrotoxicosis. Here, or in these types of patient, there will be exaggerating of the normal physiological tremor of the patient. هنا يجيك المريض أو the patient attending to you may have a tremor. If you are not going to notice this type of a tremor, أيضا ممكن أنه you may complain crisis. Even the patient with, for example, with hepatic failure may have a flappy tremor. هذه أنا نعطيكم صورة على الترمر بالنسبة للبيشنت على مود تظل ببالك بحياتك العملية وتعرف إنه this patient may have a hepatic failure and this patient may have impaired in the liver function test and sometimes you could notice that this patient may complaining from what we call it Ripper-Cherky types of movement of the hands. Another cause of abnormal movement or tremor of the patient, here the patient may have a renal failure and here what we call it the uremic twitching of the patient. Then, if we want to investigate the patient, أعيد بصورة مختصرة, investigate the patient before sitting on the dental chair is important. Second, after sitting the patient on the dental chair, you could notice sometimes abnormal movement and sometimes it may associate it with a Ripper-Cherky movement of the hand. And this may occur to the following causes. Thyrotoxicosis, there will be excessive secretion of the thyroid gland, and sometimes there will be flappy tremor, and sometimes there will be uremic. Even when we are going to speak with the patient, you could sometimes you could notice that there will be abnormal sound of the patient. يعني البيشنت صوته ما يكون طبيعي. أحب أوضح لكم إنه normal speech of the patient is usually depend on the tongue, on the lip, on the palate, on the nose. All the integrity of the oral mucosa and the muscles. In addition, والنقطة المهمة كلش, the nerve supply to the larynx and the normal lung also, that is to say the patient have the ability to expel a sufficient air from the lung. هنا ممكن تكون ال causes of the abnormal sound. First of all, the patient may complain from neurological abnormality. نعطي أمثلة like for example the patient may complaining from Parkinson's disease, or the patient may complaining from myasthenia gravis. And even though the upper molar area, the upper molar neuron lesion, sometimes the facial palsy. Even sometimes when you are going to speak with the patient, you could notice that there will be hoarseness or صوت الحصان of the patient. It is mostly occur if the patient is complaining from infection of the laryngitis, or if the patient is excessively smoking or alcoholism, or even though the patient have been make a surgical operation to the thyroid area or to the laryngeal area also. And even though sometimes أرجو أن تنتبه, you are going to see that the patient is speaking too low or too slow. That's what we call it, the impaired in the speech, mostly in a patient with a hypothyroidism. And you could notice if the patient may have any wheezing, an asthmatic patient, or dyspnea, difficulty in breathing, and sometimes this may occur due to simple causes like for example the noise, or sometimes it may affect the bronchial secretion or obstruction of the airway passage. عيد بصورة مختصرة the general examination of the patient, we could notice the abnormal movement. والabnormal of the movement قسمناها نتيجة الثايرويد، نتيجة الليفر، نتيجة اليوريميا. Or we could notice sometimes there will be abnormal sound. والabnormal sound قسمناها إلى neurology, or sometimes laryngitis, or hoarseness of the face, or bronchial asthma, or wheezing, or difficulty or insufficient amount of air passing through the lung, or inability to respirate in a normal, like for example dyspnea. After notice the movement and the sound of the patient, here the dentist sometimes during examination he may feel that, or he may smell abnormal odor. And here there are different causes. الكوز الأول اللي نعتبره الهاليتوسيس، ومثل ما راح نذكره بعدين بالمستقبل، الهاليتوسيس أكو extra oral causes وأكو intra oral causes. Or sometimes there will be ketone body is going to be represent يصير sweetness of the breath in diabetic ketoacidosis. Or sometimes patient with alcoholism, or sometimes patient with impaired in the liver function test. That is to say future hepatics of the liver failure, يعني ريحة العفن تكون موجودة. And sometimes due to the presence of the mucolytic tumor in the oral cavity, it may associate it with abnormal odor. Then abnormal movement, هذا واجبك ابني تشوفه. Abnormal sound and abnormal odor. This is the most common or the most important things that you have noticed during the extra-oral examination. Even we could notice it during the examination, the weight, the height of the patient. Sometimes the patient may complain from hyperpituitarism or Marfan syndrome, short stature, hypothyroidism, and abnormal in the fat distribution of the body. من الأمور الأخرى اللي أنا هنا بس ذكرت لكم إياها اللي يحب يطلع عليها، اللي هي البالس، البلاد بريشر، temperature، والبريثنج ريت. طبعا يعني أنا ما راح أطلب من عندك how we are going to measure the pulse rate بالنسبة للبيشنت، لكن كاتب لكم هذه الملاحظات عليها اللي يريد يطلع عليها. هنا البريكيال بالس، وهنا الراديال بالس، how we are going to measure or check the pulse. هذا بالعملي إن شاء الله راح ناخذه. How we are going to measure the pulse. How we are going to place the second and the third finger of the right hand on the edge of the left wrist. Even how we are going to measure the or measurement of the radial pulse. And what are the false way in measuring the radial pulse. هذا العفو مو نظري، هذا له علاقة بالعملي، لكن أنا ذكرت لكم إياه على مود طبيب الأسنان عندنا يقدر sometimes when he is going to expose to any crisis how we are going to measuring that. Even the carotid pulse and how we are going to find the carotid artery. هذا كله بالextra oral examination in addition to the pedal pulse. Pedal pulse, how we are going to find the pulse on the top of the foot. Butter pulse. أيضا نجي هنا إلى general examination of the patient also. What is the diagnostic feature? مثلا طبيب الأسنان ممكن يشوف yellowish skin or eyes، وهذا most common. ممكن أن يجيك وبصورة عامة jaundice. There will be too much of waste product by the body which is going to be break down. مثل هكذا حالة البيشنت يعني عفوا طبيب الأسنان يحط بباله sometimes it is considered to be as hepatitis. راح ناخذ or impaired in hepatitis or impaired in the liver function test, or sometimes it may occur due to the obstructive jaundice, any problem with the gallbladder or pancreas or even though alcohol abuse. هذه هي النقطة الرئيسية. أيضا نرجع ناحية عملية. When we see that the young patient attending to you and he is complaining from yellowish skin and eyes, we suspect that the hepatitis it may consider the main cause of that. يعني من نشوف اليوم patient يجيني مثلا عيونه بها اصفرار مثلا ادزه على test hepatitis واللي راح ناخذها بالتفصيل ان شاء الله بالمحاضرات القادمه. لكن for example if I see that the patient is an old patient and he's yellowish on the sclera, we suspect that other causes more than the hepatitis is may associated with the yellow sclera. Like for example there will be stone in the gallbladder or pancreas, pancreatic or alcoholic patient. Sometimes during examination or during the extraoral examination we could notice the presence of the sores on the lip. Sometimes it could be a viral infection, like for example the herpes virus. Even though during examination you could see that there will be a butterfly rash on the face of the patient. It could be a systemic disease. مثلا البutterfly rash mostly associated with SLE or systemic lupus erythematosus. وعادة هذا أكو precaution during dealing with these types of patient. Sometimes we are going to examine مثل ما راح نشوف if there will be hair in unusual places. And sometimes drooping of the eyelid. Sometimes the patient may be born with it or get it over decay. It's often harmless, but it can be a sign of problems within the brain or within the nerves or eye socket. Sometimes this types of patient may have a double vision, weak muscles, and so on. أيضا من الأمور اللي يجب ملاحظتها أثناء examination of the patient, if the patient is complaining from facial palsy, طبعا facial palsy sometimes أرجو أن تحط ببالك recurrent facial palsy. Sometimes it may associate it with a serious condition. لأنه مثل ما نعرف الفيشل نيرف هو يفوت ضمن السليفري gland. Any tumor of the salivary gland may affect the function of the facial gland. وهذه أيضا إن شاء الله نشوفكم الكثير من الكيسات في هذا المجال، كيف أنه المريض كان يعاني فقط من facial palsy لكن يكون عنده recurrent، ومن خلال الانفستيجيشن مالتنا انه شفنا هذا الفيشال palsy it is not related to the viral infection or any other causes but it is related to the salivary gland. يعني هذا أرجو أنه تنتبهون أنه sometimes the facial paralysis may associate it with other symptoms. أرجو أنه تجر خط تحت هذه العبارة وتظل ببالك في حياتك العملية. كل اللي نعلمك إياه ابني هو مفيد from the practical points. يعني نحن لا نتكلم عن theoretical information، نحن نتكلم عن practical points of view. Sometimes during examination you can see that the stroke happens when the blood flow is cut off to a part of the brain. And this type of patient may complaining from numbness, weakness, and so on, slurred speech, double vision. كل هذا يعتبر abnormal بالنسبة للإكسترا oral examination. Sometimes we could notice مثل ما راح نشوف different characteristic features of the face. يعني راح ناخذ مجموعة مثلا yellow spot on the eyelid. This is thalassemia also, which is considered to be increasing the level of the cholesterol. And sometimes they are not considered to be dangerous or painful. Sometimes you could demonstrating that the patient may complaining from puffy eyes. That is to say, the space below eyes can fill with the fluid. And here the patient may have a swelling or a puffy face. And sometimes the eyelid is going to be weakened, and it's sometimes may associate it with infection, or sometimes the impaired in the kidney function test may associate it with that. Sometimes you are going to notice it during the clinical examination, the melasma, which is usually represented as gray-brown patches of the skin of the face. It mostly occurs after pregnancy or sometimes after taking certain birth control. And in other cases, it can be lost for years, or sometimes it wouldn't going to be disappeared. Even though during the extra-oral examination, you could see that there will be hair loss. This is what we call it, the alopecia. And this type of patient may complaining from impaired in the immune system. Then, من الأمور اللي نلاحظها بالجنرال characteristic features of the face، أرجو أنهم تنتبهون وياي. ناخذ قسم من الفيسز اللي تكون مهمة، نجي على هذا. انتبه هنا when I'm going to give the pointer. This is what we call it the spider nevi. And this is mostly occur on the face. This may give me an idea that this patient may have impaired in the liver function test. And you have to send the patient for the liver function test. This is what we call it the face of hepatic cirrhosis. هذا may complaining from sunken eye and watery conjunctivitis. And for example, this patient may complaining from mitral stenosis. لاحظ هنا when I'm going to be put the pointer, the minor face or mitral flash. لاحظ in this type of face, viral faces, mostly in women are suffering from adrenal cortical hyperplasia. How the present of the hair in unusual condition, and this mostly occurred due to the adrenal cortical hyperplasia. Just look exactly this phase, what we calling وهن العضلات or myasthenia gravis. Look, dropping of the jaw and the patient inability to closing his jaw without an assistant. This may occur due to the deficient in the action of the zygomatic muscles. هذا البيشنت ما يقدر يسد حلقه، يبقى حلقه يكون مفتوح بوهن العضلات نسميه بالمايزوثينيا gravis. And this patient may complaining from ptosis. لاحظ التوسس الآية مالته شلون تكون نازلة. Sometimes he's complaining from sneering smile. Another face which is called the carcinoid faces or وجه التمساح. The patient may have a facial flashing. لاحظ الفلاش of the face. هذه الأماكن اللي أنا دا أشرها. Here the patient may have a facial flashing due to the excessive of the serotonin secretion by the tumor cells. And this types of patient may have a massive liver metastasis. Another phase, what we call it the macrognathia. لاحظ هذا السندروم يدعى بالبيربر syndrome. Here the patient may have a shortening horizontal ramus of the mandible. لاحظ the tongue of the patient is said to be backward, and this type of patient may have frequent hack of dyspnea and cyanosis. صعوبة بالتنفس أيضا لأنه backward position of the tongue is mostly occur. This is what we call the macrognathia. And this is what we call it the Down syndrome. Depressed in the nasal area, protruded of the tongue, slit of the eyelid. The كلها it is considered to be as abnormality, and this patient may complaining from congenital heart disease. هذه the most common or the most common serious condition that may associate it with the patient. طبعا اكو picture اخرى اللي ممكن ايضا نسوي فيها تلعب بالكوشن سيندروم او بالمون فيس. هذا this types of patient may taking excessive amount، يعني نسميه احنا بال excessive amount of corticosteroid due to the exogenesis or sometimes endogenesis. يجيك البيشنت كوشن فيس with a buffalo neck. هذول اغلبهم ياخذون ادويه immunosuppressive، ياخذون ستيرويد لفترات طويله. ايضا نرجو الانتباه الى هؤلاء patients. اذا بصوره عامه the butterfly rash، لاحظ انتبه هنا، important during the extraoral examination, and the mild rash which is mostly occurred due to the SLE, and sometimes it may occur due to another causes. طبعا هناك مو كل المايلر faces may associated with SLE, but we suspect that the lobus or systemic lobus or DLE is going to be affected. ونذهب ب laboratory test معينة in order to differentiate it where there is another causes. هذه the most common characteristic features of the face that the dentist is going to be noticed during the examination. أيضا النقطة الأخرى اللي مثل ما قلنا facial movement أيضا, which is usually under the control of the nervous system, sometimes may give me an indication The patient may have any lesion of the facial nerve or hypertonicity of the facial muscles. Or sometimes there will be chorea types of movement and so on. إذن هذه أهم characteristic features of the face that we are going to notice. الآن نذهب إلى تكملة extra oral examination. هذا ملخص مفيد للexamination or clinical examination of the patient. اتكلمنا عليها بالextra oral examination هو الفيشل characteristic features وقسمناها إلى تقريبا 7 أو 8 characteristic features that may give you a hint that this patient is serious condition. وقسمناها إلى المايلر فيس والسبايدر نيرفاي والكوشن فيس and so on. وتكلمنا أيضا هنا على الfacial movement, whether it is may related to the central nervous system or it may related to the lesion of the facial nerve or hypertonicity of the facial muscles. راح نتكلم أيضا بالإكسترا أورال إكزامينيشن. هذا الفيلد اللي راح نتكلم عليه the eye, lip, neck, lymph node, the skin, the cranial nerve examination. هذا كله ضمن الإكسترا أورال examination. Facial characteristic, facial movement, the eye of the patient, the lip, the neck, the lymph node, the skin, and so on. من الأمور اللي طبيب الأسنان يجب أن ينتبه عليها أثناء الإكزامينيشن of the patient هو الإكزامينيشن of the eye. طبعا هو مو وظيفة it is not a responsibility of the dentist to examine the eye, لكن we have to know that there are many causes or common systemic diseases and local diseases which is going to be affected the eye. Some systemic diseases, diabetic. Here every diabetic patient should have their eyes examined in a diagnosis. Sometimes those patients may complaining of from diabetic retinopathy or the microvascular leakage, which may lead to exudate, which is occur in the layer of the retinal affected the vision. Even though the patient may have excessive or excessive glucose interference, the normal metabolism of the lens and result in the premature cataract. Another causes which is going to be affected the eye أول شيء تكلمنا عن diabetic اثنين الhypertensive والhypertension. Sometimes the hypertensive retinopathy may occur also, and there will be change in the swelling of the optic nerve, and even though there will be vision loss. Another cause which is going to be affected the eye is the thyrotoxicosis. And here, there will be excessive thyroid gland, which is called the protruding of the eye. And even though there will be limitation of the eye movement, and the patient may complain from double vision, coronal diseases due to due to the exposure and dryness, and sometimes damage of the optic nerve may occur, even though the patient may have a permanent loss of vision. Other causes which may affect the eye, cancer. وهذا كلش rare condition ومو من يعني it's not يعني it's not our job but sometimes the cancer may start in the eye and separate to involve another area of the body, or sometimes it may occur in any part of the body and is some in the brain, or it is going to be metastasis and affect the optic nerve, and sometimes the retinoblastoma may occur. And this patient may complaining from frequent recurrent redness, and he may aid in their vision loss. عندنا we have to know oral medicine specialist أو كطبيب الأسنان متى you have to ask the patient. يعني هسه تعرفنا على systemic diseases which is going to be affected the eye. نريد نعرف متى طبيب الأسنان is going to ask about the examination of the eye. متى طبيب الأسنان يسأل المريض during taking history if he is complaining from any eye problem. First of all, if the patient complaining from Sjogren's syndrome, and here the patient may complaining from dry eye, dry mouth, and involvement of the rheumatoid arthritis, involvement of the joint, and sometimes the patient may complaining from writer's diseases. When patient oral and genital and the eye involvement, and sometimes the patient may complaining from Stevens-Johnson syndrome, mostly associated with eye involvement, or sometimes the patient may complaining from pemphigus vulgaris, which is mostly affected the eye and sometimes may associated with blindness. In addition, if the patient is complaining from recurrent aphthous ulceration, like for example, the Behçet disease, then إذا ممكن نقولها بطريقة معينة أو بسؤال معين, when the dentists have to investigate or have to ask about the eye involvement, writers, Stevens-Johnson, Behçet, and also in Sjogren's syndromes where the eye is going to be involved also. Then هناك local أعيد بصورة مختصرة. Even we could notice if there is yellowish of the sclera and so on. And then هناك systemic diseases which is going to be affected the eye. وهناك oral diseases or oral involvement may associated with involvement of the eye also. هذه بصورة عامة manifestation of any systemic disease, whether there is a congenital disorder, traumatic, vascular, or blood, or what we call it skill cell anemia, neoplastic disorder, metastatic carcinoma, in addition to the multiple autoimmune disease which is going to be affected. Connective tissue disease, other autoimmune SLE, sarcoidosis, giant cell, temporal arteriitis. حتى الثايرويد gland مثل ما تكلمنا عليها, it may associate it with involvement of the eye. أغلبهم مثل ما قلنا those types of patients may complaining from exophthalmos. نسميها the starting expression of the abnormal exposure of the sclera between the iris and between the eyelid, which is considered to be the primary features of the hyperthyroidism. Also, the multiple sclerosis infective, هذه أداة إلى الأمراض اللي ممكن تأثر على الأورال cavity directly or indirectly وتأثر على extra oral examination. Other things that is going to be noticed during the extraoral examination of the lip. يعني بعد أن تم فحص الآيز، طبعا الآيز تفحص مثل ما قلنا عن طريق بالنافيس ميثود اللي راح نشوفها بالطريقة العملية how the patient is going, how the dentist is going to be stand behind the seated patient and then tilt his head backward and observe the eyeballs. راح نتعلم هسه هذا راح نتعلمه إن شاء الله بالعملي شلون نفحص الآيز of the patient، وين نوقف على مود نفحص الآيز. We are going to demonstrating that. الآن نتكلم عن اللب. اكو عندنا مقولة تقول an indication of ill health may be given by the lip. Sometimes it's going to be representing as a dry, cracked in most illness, even of a trivial nature, but soreness and collection of the epithelial cells and the debris of the food or bacteria could be present in a serious disease such as uremia, or even if the patient is complaining from prolonged fevers for a long period of time. Then ما هي الأمور اللي ممكن يلاحظها البيشنت during examination of the lip? First of all, we could demonstrating that if there is any crack of the lip، وأعتقد كل الامتحانات العملية اللي ممكن أنه أعطى لكم صورة لب ويعطيك فد characteristic features مالته، مثلا الانجلر colitis which is going to be representing as eroded erythematosus area on the angle of the lip, the cracks of the crack at the corner of the mouth, and here it may associate it with a bacterial infection. Specify the beta hemolytic strep or the Staph aureus, or sometimes it may associate it with a candidal infection. Another disorder that may occur on the lip, actinic colitis, which is mostly affected the lower lip, and it is going to be manifested either as an atrophic changes with associated erythema and leukoplakia, and sometimes there will be thickening of the epithelium. Even sometimes it may associate it with a viral infection. And here there will be eruption of the vesicles, like for example in the herpes simplex type 1, which is may occur in the oral cavity. Other causes of the abnormality of the lip كلها إن شاء الله نشوف لكم إياها بسلايدات احنا الآن نتكلم عنها، لكن إن شاء الله راح ناخذ محاضرة نشوفك الأكتينيك كولايتس كيف تبين، نشوفك الأنجلر كولايتس how it is going to be represented. وفي كثير من الأحيان even though the anemia or the cyanosis is going or mostly representing on the lip. أرجو أنه تنتبهون sometimes اللي راح نشوف لكم إياه أيضا بالسلايدات القادمة. Medicine disease. Here the lip may be representing as a pigmented. Multiple pigmented area is going to be representing on the lip. أعتقد لهنا أنا خلصت الساعة. من المحاضرة الأخرى راح نتكلم على الإكزامينيشن of the skin of the patient. راح أعيد اللي تكلمت عليه بصورة مختصرة، أرجو أنه تسجله يمك بورقة وقلم على مود تعرف احنا شو تكلمنا. نحن in this lecture we emphasize on the extraoral examination. Extraoral examination هذه الصورة بدها تطلع يمكم؟
اي نعم دكتور.
اوكي. بالاكسترا اورال اكزامينيشن تكلمنا عن ما يلي. تكلمنا abnormal of the eye، كيف طبيب الأسنان ممكن أن يلاحظ the eyes of the patient، وشنو systemic disease، شنو ال oral associated with the eye involvement. يعني الآن أنا أريد طبيب الأسنان من عندكم من يتخرج ويشوف أكو recurrent aphthous ulcer مثلا موجودة the oral cavity. He could ask the patient if he's complaining from any eye involvement. تكلمنا بالإضافة إلى الآي the examination of the lip، وعرفنا إنه أكو actinic colitis وأكو angular colitis وأكو viral infection وأكو anemia وcyanosis, in addition to the Addison disease, which is going to be presenting as a pigmented on the lip. Then, first of all, the characteristic features of the face, examination of the eye, examination of the lip, the presence of abnormality of the face, which is going to be noticed, spider nevi, presence of the mylar face or red erythematosus area on the face. ماذا تعني؟ التوسيس ماذا تعني بالنسبة للدنتست؟ الكوشن or المول فيس ماذا يعني بالنسبة للدنتست؟ Down syndrome, which is going to be represent. قبل هذا كله، قبل أن نسوي facial characteristic features أو examination, we have to notice the following: abnormal movement of the patient. قسمناها إلى الثايرويد، إلى thyrotoxicosis، وإلى flabby type of tumor، وإلى اليوريميك twitching. وأيضا تكلمنا عن الابnormal in the abnormal of the smell of the patient, if the dentist is going to be noticed if there is abnormal in the face in the smell of the patient, and what are the causes. وتكلمنا if the dentist is going to be noticed abnormal facial movement, or there will be abnormal in the control of the nervous system, which may give me indication of the lesion of the facial nerve, or if the patient is complaining from hypertonicity or hypotonicity of the facial muscles. This is the most common important things that the dentist have to notice before he is going to make a dental treatment. إذا قبل ما المريض يبدي بالdental treatment، اللي أريد أوصل لكم رسالة، you have to exploring about the systemic diseases before you are going to take into consideration the intraoral examination. يعني رجاء بحياتك العملية قبل أن تبدأ، وهذا أيضا during يعني الهيستوري تيكينج، الرسالة اللي أريد أوصلها لكم عندما تتخرج ابني، إنه تبدأ بالسيستميك ديزيزز، يلا تجي إلى الأورال. You are going to investigating and you are going to see if there is abnormal smell, abnormal sound, abnormal height or weight of the patient, abnormal walking of the patient, abnormal movement of the patient, abnormal facial characteristic, before you are going to start your dental treatment. أرجو أنه تكونون وصلت الرسالة لكم بصورة واضحة. And we are ready to answer any question that is relevant to our subject. وبالمحاضرة السابقة تكلمنا عن الهيستوري. المحاضرة القادمة راح نتكلم إن شاء الله how we could examine نكمل extraoral examination through the skin and through the lymph node, which is considered to be very important. Please, again, if there is any question, try to arrange appointment with your representative. and we will be ready to answer any question. Thank you a lot. دكتور خلص العفو المحاضرة.
تمام. Thank you so much دكتور. راح أنهي التسجيل هسه.
اوكي هسه تسجل عيني وتدز لي اياه على انهي التسجيل.
نعم نهيته.
نهيت عيني.
نعم دكتور.
اوكي دكتور العفو.